Hi guys, it's Ichiarakwe Unkwanta. Welcome to Parenting Specials. But before we go into today's topic, I want to thank each and everyone who has subscribed so far, liked and commented. And I want to apologize for not being able to put out the video 2 weeks ago. We actually had technical issues and so we're not being able to do so, but we are back and we are better. Today's topic is sensory processing issues or sensory processing disorder. As the name implies, it has to actually do with the senses in the brain, how information passes through the brain and how it's organized before a feedback is given. For you and I, when you wave, we know we are supposed to wave back. That is immediate. But for children who actually have sensory processing issues, it actually takes time for the brain to assimilate the information they have gotten before they can give you feedback. Now, this may affect their 5 senses, which is taste, the smell, the sight, hearing, and then touch or feel on the skin or surface, whichever way. Now, these children have certain triggers. You may notice they are usually plunging or covering their ears, they're covering their eyes, they're covering their faces, they don't want to be around people, they don't want people coming close to them. You may notice certain things that trigger those things. When you do as a parent, my advice is get them out of that particular place or actually prepare them for what may come next so that they know how to handle it whenever they're in that situation. There are 2 major types of sensory processing issues, and we may say one is hypersensitivity or hyposensitivity. Some children may actually experience the both. For hypersensitivity, you notice that they don't like to be touched, they don't like people coming close to them. They're really conscious about their environment, they're conscious about lights, about sound. They're really sensitive, they react immediately. Now, for children with hyposensitivity, they actually seek out these things to actually stimulate their senses. They may see a surface and they want to touch it, or they want to touch somebody. They want to know what that thing feels like, because they may actually have touched it a day before, but their senses actually delays the process, so they actually want to touch and feel, and they're actually self-harming. They may harm themselves more often, they may harm other children, but because they don't necessarily feel pain, they may think the other child also doesn't feel pain. So when you notice that your children actually have this, you should actually know how to work around it. Now, for the solution of a way you can help, note that nobody grows actually out of sensory processing issues. No, you don't grow out of it. But there are certain things you can do, or therapy you can do, that actually helps you as a parent and manage that child. Make it okay for a child to be able to manage themselves and how to react. Train that child in a way that the child will actually be able to react when certain things happen. And one thing you can do is talk therapy. Always make sure you talk to that child. Like when that child is going through a tantrum or throwing a tantrum, or is overwhelmed with information, you calm them. They react by shouting, crying, however, but you make sure that you calm the situation, that make them know that you understand what they are going through. You can get a ball and say, oh, is it this ball you're crying for? I'm going to give it to you. You have to learn to calm down. Soothe them. You can actually motivate them by actually getting a scoreboard. Whenever they do something that is good, you reinforce them by giving them a star, give them thumbs up, make them feel good. Do not actually take them out of play groups or whatever. Let them feel included. Don't necessarily take them out of those places. You can actually for their meals, you can actually create a meal journal. For children who have sensory processing issues, they don't like certain foods. You may notice your child is actually going for one particular kind of meal. They may like noodles. You can actually work around noodles. You may incorporate different kind of vegetables into that particular noodles, because that is the only thing they may want to eat. And it's not because they don't want to eat something else, it's because of the taste they may feel within their mouths. So you as a parent should actually be able to find out what they like and work around it. When they go out and then you're in a public place and you can't control the environment or what happens in the environment as a parent, always prepare them for what comes next. You understand? If you're somewhere that there's an alarm that is going to go off, tell them, oh baby, there's an alarm that is going to go off. So they actually have to prepare themselves, and when they prepare themselves, they can actually organize how they are going to react when that sound or noise comes up. You should actually also make them feel safe, feel included. train them the same way you would train other children generally. Also, from their therapists, you actually want to find out things that have worked with their therapist, and also how you can apply those things at home. I hope you enjoyed today's topic. Thank you. Don't forget to like, to subscribe, and share. Thanks.